Okay, so I'm going to share some of this video of these people who have gone through the same treatment I've been through and have amazing results. I'll share that in a little bit, but and you can see more further down here my story. I was blindfolded for years, couldn't go out, couldn't do anything, massively depressed. You can imagine it was rough. So anyways, I'll share that, but let me read this. This is from bjornbrain.com, my website. You can check it out, go to articles. Best treatment for depression is TDCS. When searching for the best treatment for depression, it's easy to feel lost among the many options and the conflicting information. Tell me about it. While traditional treatments like medication and therapy have helped millions, they don't offer the results that they don't always offer the hope everyone's hoped for. This can leave those struggling with depression feeling like they've been exhausted all possibilities. But what if there's an emerging technology that holds new promise for relief? I'm telling you, this is the greatest thing you can hear about. There is nothing like this out there, okay? That combines all the stuff that I'm going to tell you about now. It is amazing. Transcranial Direct Current Stimulation is gaining attention in the field of brain health as a potential game changer for depression treatment. This non-invasive therapy, listen, non-invasive, uses low electrical current stimulation to target areas of the brain, supporting its natural ability to rewire and create new neural corrections. But can TDC truly be considered one of the best treatments for depression? Let's explore what makes this technique unique, okay? Just wondered real quick, you flood the brain with chemicals, medication, and the areas that don't need any attention, they're going to have issues with, which is why the symptoms are usually so severe, which is what I had when I took medication. It really just messed everything up because these areas didn't need any treatment. It was specific areas. You have to be very precise, and that's what TDCS does. Okay, check this out. What makes TDCS unique? TDCS works by delivering gentle electrical stimulation to specific areas of the brain involved in mood regulation. Unlike medication, which can cause systematic side effects, TDCS focuses solely on areas that may be underactive in people with depression. This targeted approach minimizes unwanted side effects while promoting improved brain function. By enhancing neuroplasticity, your brain's ability to adapt and change, TDCS can support long-term improvement. Early research has shown that promising results, especially for individuals who have not responded well to traditional treatments. Okay, proven results. Check this out, okay? TDCS used in the military. This isn't something just came out of nowhere or only a few people use. This is all over the place, okay? A lot of people are using it, but they're using it to train snipers and drone operators. But now they're using it, like Dr. Beck is using it to help people with illnesses, with depression, and with stuff that I had. TDCS isn't a new concept. In fact, it's been tested and used in high-pressure environments like the military. Soldiers, snipers, and drone operators have relied on TDCS to improve focused decision-making and mental clarity under extreme conditions. This same precision is now being harnessed to healthcare to help patients with depression and other brain-related conditions. I'm telling you, it is amazing the stuff that they're doing now. They use this to help people learn how to focus in the military, but now it's been helped to people like me who have severe depression, anxiety, brain disorder issues. And so anyways, okay, one thing I didn't mention here is that you can be treated at home. You don't even travel anywhere. Dr. Beck's in Australia, but you can actually just do this over a video call, and they send you the equipment, they tell you everything they need to do, and it's all supervised. It's amazing. It's the coolest thing ever. I wouldn't tell people about it. It's not. It's so discouraging to tell people, you gotta go to Australia for a year. Nobody can afford that, or 6 months, you know? But now you can do it over a video call, which is why I'm so incredibly excited about it. So let me show you this video. This is from Dr. Randy Beck, Institute of Functional Neuroscience, IFN, Dr. Randy Beck. Home care available for international patients via video call. His phone number, all the stuff. Use promo code Bjorn, and you will not only receive a discount on your first treatment, but you'll also be supporting my mission to reach as many people who are in the same situation as me. I'm not a doctor, I'm a patient, but I tell everyone about it. Let's play this video, and then I'll read the rest of the article. Okay, so this is a story of JK at age 16. She had a traumatic brain injury while on holiday with her parents. You can see she had a car crash. JK was told there's nothing that could be done to her. Okay, a story of so many, including me. So you see the eyes are going all over the place. She's not able to focus. It's very difficult for her to do that. So after 6 weeks of intensive treatment plan at IFN, JK resumed normal life attending university with her peers. Check this out. Look at that smile. See? Isn't that incredible? After 6 weeks of treatment, this is the result. And people thought the doctor was telling her there's nothing that can be done. All right? It's just incredible. Okay, this is a story of Madison at age 4. Madison was treated for IFN for severe epilepsy, could have up to 100 seizures per day. Very, very serious. Madison's first QEEG was at IFN. You see, he got the cap on with the sensors. Within a week, her seizure rate dropped by 90%. If that's not life-changing, I don't know what it is. 90%. For her and her family, totally life-changing. Look at that smile. Okay, next one is, this is the story of RH at age 12. RH had a bicycle accident resulting in a mild concussion. In the following days, he deteriorated, developing significant leg pain, and ultimately unable to walk without assistance. Repeatedly, his parents were told he was simply attention-seeking. He can't walk. And this is the story of so many of us. The doctors just say, oh, I just want attention, or just, it's a thing. It's so sad, okay? We just need to get the word out. People need to know about this. So that's what the parents were told. Then they went to, after 6 months care of IFN, look, see, the guy's walking. He needed the brain to be rewired, it was possible for him. He wasn't seeking attention. This is 9 months of care with IFN. He's that walking. It's amazing. RH is now back to living a normal teenage life. Just incredible. Okay, this is the story of Sam at age 18. Sam suffered a severe neck injury while at the beach, which left him quadriplegic. Very, very serious. He was told he had less than 1% chance of regaining any movement. After intensive 6-week treatment, see, he's moving his left leg because there was a connection in his neck. So they probably ran TDCS up and down the spine to restore that connection, and then they work on the brain. But they see there's movement in his left foot. After 12 months of treatment with IFN, see, he's walking aided. See, now he's walking just with Dr. Beck next to him. And then he's dancing his way to recovery. That's a miracle. Look at that. You see what he's doing? 1% chance of having any movement. Finally, against all odds, Sam walks unaided. I mean, look at that. Whole families can be transformed forever, okay? This is Ben. Let me go back real quick. So this is Sam. He walks unaided. Incredible. This is the story of Ben at age 12. He was a problem child, turned award winner. His teachers didn't know what to do with him. He was diagnosed with 3-year history of ADHD and dyslexia. See his eyes? So he began failing at several schools, unable to achieve the required milestones. IFN identified he suffered with sensory confusion involving movement of his eyes. It was not ADHD, but that's what the label they gave him. That was his challenge, not ADHD. So there was something that had to be rewired in the brain. So after 12 weeks of treatment, he, let's see what it says here. After 12 treatments with IFN, Ben is now winning awards at school. Amazing. He can read and no longer suffer with anxiety. He's back to living a normal life. I mean, if that isn't incredible, I don't know what is. In the same story that I had, people said all these different things. It was just, all right, so if that isn't just amazing, I don't know what is, okay? I'm telling you, this treatment is, everyone needs to know about it. If you have issues or know anybody issues, they need to get a scan with Dr. Beck and just find out what's going on in the brain, okay? Let me just read through this and I'll explain more about how the process works. I look back, the evolution of TDCS. Though TDCS may seem like a modern breakthrough, its roots extend to as far back as the 19th century. Italian scientists were among the first to study mild electrical stimulation could affect the brain. Over decades, researchers refined this technique, transforming it from experimental curiosity into potential life-changing tool. So it's not shock therapy. Now it's very, very different. You don't feel anything. Just make sure you have enough saline on the pad to be able to and you won't feel any tingling. QEEG scans, the foundation for precision. One reason TDC shows promise as a depression treatment is its ability to target specific areas of the brain. This is where QEEG comes into play. QEEG is an advanced brain mapping technology that provides detailed analysis of brain activity, identifying areas that are overactive and underactive. Clinicians like Dr. Randy Beck, a leader in brain health, use QEEG to tailor treatments. By comparing patients' brain activity of that of healthy clinicians, they pinpoint the exact areas where TDC stimulation is needed. This precision approach minimizes side effects and maximizes the effectiveness of treatment of each case. So instead of just treating the whole brain with chemicals and flooding it and then having all these issues, they go specifically to this area or that area or this area or that area. Is this area talking to this area? Is this area talking to this area? Is this too fast? Is this too slow? What's going on in the brain? Is the whole brain too loud? Is it too slow in the prefrontal cortex? Like, what is going on? And then you can look at the brain map. You can see it's green, blue, yellow, all different colors. Red is too fast, blue is too slow, and green is what you want. But they'll compare your scans, my scans, with everyone else. I was so far out there. It's like everyone else told me it was game over. But Dr. Beck was able to bring me back to the normal range. I'm about 80%, I'm not 100%, but that's how it works. You do a scan, and then every 18 sessions, you do another scan, another scan, another scan. I'm telling you, it is super effective. So let's read why Dr. Randy Beck's approach is so effective for depression. While searching for the best treatment for depression, many available options primarily focus on symptom management, such as reducing sadness or anxiety without addressing the deeper causes of the condition. Dr. Randy Beck's approach stands out by targeting the brain's underlying imbalances. His method combines time-tested brain rewiring techniques with advanced technology like Transcranial Direct Current Stimulation, QEEG. So one thing I just want to say about that is that, so for example, often what happens is that let's say you're at a rock concert, you're the rock star, right? You're 10,000 people, fans are all cheering you on. You're at a high. Adrenaline is going, you're like, woohoo! And then after that concert, you go home, you can sleep. So the brain has to bring you down, and sometimes it goes way down here to then bring you back to normal. But so it swings down, and then so you kind of feel like a down, and then it takes you up here. But because of drugs, alcohol, medication, diet, all these different things, sometimes we get stuck here, which is what I was. I was stuck right here, and I couldn't get back to normal again. So that's what this treatment does. It's like, okay, it sees the imbalances. Okay, let's get you back here. Right now, we've got to nudge the brain to get it back here again. So, because you've been there before, but you just need some help to be able to do it. So that's basically how it works. A simple way of explaining it. He can explain it better, but sometimes we just get stuck and you want to get back up there. So the brain gets stuck in this mode of being very depressed, sad, anxiety. And then, like what I was, I just couldn't get back. Oh, that was rough, man. Okay. So, and then he combines that unique blend of expertise and innovation. Dr. Beck's approach draws from decades of research in brain rewiring, blending both traditional and modern techniques. One classic example involves using a mirror to create an illusion of movement of a paralyzed limb, a strategy that tricks the brain into rewiring itself by using new neural pathways. So anyways, let's say your left arm is not functioning, so we need to hack the brain to be able to do that. So Dr. Beck uses these techniques that he learned at the Carrick Institute when he worked there for 10 years, which didn't use QEEG and TDCS, but they use these old school techniques that have been developed over decades. So he combines everything into one. So in this one, if the left arm is not functioning, they put a mirror and they'll lift the right arm while the patient is looking in the mirror, and they think they're lifting the left arm, but they're actually lifting the right arm. So they're hacking the brain. It's crazy, I know, but the different techniques that he combines, I've been so many different places, spent $250,000 on treatment, but I'm telling you, what they do, he combines everything beautifully into one treatment. All these other places I went to use variations of everything, but they didn't have a comprehensive approach, which is what Dr. Beck does, which is why I'm excited and tell everybody. And you can be treated at home. You don't have to fly out somewhere, okay? I'm telling you, it's amazing. Precision that makes TDCS unique. One of the biggest challenges treating depression is the variability in brain function between individuals. Depression often involves both underactivity and overactivity in different regions of the brain. Unlike treatment that affect the entire brain, such as medication, TDCS can precisely target areas of the that require intervention. This level of precision reduces the risk of overstimulating healthy regions, which can sometimes cause new problems. You start messing around with healthy areas of the brain or areas of the brain that are functioning normally, you're going to have other issues. It's just, that's why chemicals, flooding the brain with chemicals, just creates a lot of issues, So here you can see the electricity goes in here and out here, and you just a little bit, just a tiny, tiny bit. Treating the brain, not just the symptoms, and it's just a huge game changer, I'm telling you. For me, it worked. All these other people, it's worked. It takes time. You do a little bit of change every time. You can't do a lot of changes, just a little bit every time, because the brain, it might backfire. You got to go very, very slowly to nudge the brain in the right direction, to normalize, to get back to that normal. But people with OCD, bipolar, light sensitivity, I had all this crap, and traumatic brain injury. Here's a case study of somebody with autism, really bad, slamming doors, couldn't talk, all this stuff, and now they're functioning normal. Nobody would even say that they had any issues. So you can read my story right here. I was a mess. I was in really bad shape. Told it was game over, but and I was crazy. That's what they said. But Dr. Beck got me well. So you can read my story, $250K. I'm telling you, I've been everywhere. This is the best place. Promo code Bjorn, get a discount on your first treatment, but you also be supporting my mission to tell everyone about this, because everyone needs to know, especially these kids running around having all these issues. You saw the kid, Ben, how this kid right here, how he suffered with sensitive confusion, and now he's normal, back normal. We need to get the word out there. If you got any questions, let me know. This is my website. I have an FAQ here. I try to add more questions as I go. Contact, articles, everything. I just put everything out there because I want to tell everyone about it, because it is just that good. And if you're going through depression, I know exactly what it's at. I think what it's like. It's not fun, man. It's rough. Let me show you one more thing before I sign off. You can go here to IFN's website, and they have a lot of different case studies. And you can learn learning difficulties, skull fractures, separation anxiety, PTSD, seizures. I mean, there's all kinds of case studies. So just read up on it, dyslexia, emotional instability, all these different case studies, and the people who have recovered and gotten well. So, that's more information here. If you have anything I can assist with, let me know. Send me a message, give me a call, email, and you can see what I was like. I was a mess. Brain was stuck in panic and couldn't get out of it. Like, I wasn't depressed. I was way beyond depressed. Stuck in panic attack. Couldn't snap out of it. because the C1 was pressing on the brainstem, which was pressing on the spinal cord, and it was just creating the signals all messed up. So they had to get that restored first, then they got to fix the brain. So because it'd been chronic, I got stuck here and wasn't able to come back here. So I needed help to get back here. So telling you, transcranial direct current stimulation, it's the greatest thing out there. There's nothing else like it. Even used in the military for other things, but now they use it to treat people to get the brain back to functioning the way it's supposed to. So if you have any questions, let me know. Thank you for listening, and hope to hear from you. Take care. Bye.